Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today in this video, I really just want to share some exciting news that I just received regarding my mental health treatment with bipolar disorder. As many of you know, I've been sharing some videos about bipolar disorder and how I treat it and how I deal with it on a personal basis. I just wanted to kind of update you on the most recent news that I got in terms of my treatment. Put this into context, before when I was living in a city a couple years ago, before moving back to my hometown, I had a family doctor, a psychiatrist, as well as a psychologist. But when I moved back to my hometown, I'm now living in a place that doesn't have a lot of mental health resources, so I lost out on finding a new psychiatrist. And after putting in a referral about 3 years ago, I just finally got a call from a psychiatrist's office telling me that they will take me on as a patient. The best thing about this call is that it's actually a psychiatrist that has seen me twice in the hospital during manic episodes, so they would have a really good idea of my situation and how I react with my bipolar disorder. It's also going to take a lot of pressure off my wife and I, as she's a pharmacist as well as myself, so we've been kind of using our kind of knowledge that we learned in school and through our personal experience at work kind of help with my medication management in terms of my psychiatric meds. Now, I should say I do have a family doctor, but unfortunately they're not very comfortable with adjusting my psychiatric medications. So for me, that would be Zeldox, lithium, Latuda from time to time, as well as loxapine and bupropion. So I've kind of been stuck on the same regimen of medication for quite some time. Now, I will say, with the help of my wife and my sister, who's also a pharmacist, we have managed to keep things under control, as I haven't had a manic episode in the last year and about 4 months. The main problem with my diagnosis of bipolar and how it reacts with me personally is that my manic and depressed episodes seem to go along with the seasons. So I usually have a manic episode in the spring if I'm going to have one, and depressive episodes in the wintertime, usually starting in about October. So during those times, I do need to tweak my psychiatric medications, and we were kind of just doing that on our own, really. I mean, we had loxapine that I use to prevent me from going manic. So if I feel off one day, we would talk about it, my wife and I. And we would adjust that medication, either 10 milligrams or 20 milligrams. In the wintertime, we have bupropion, the antidepressant, so we would usually start taking that when October rolls around to try to prevent myself from having a depressed episode. But now we can really rely on the psychiatrist to fine-tune those medications using their experience after treating many different patients with bipolar disorder. I do have to say this is a really happy day for me. Like I said, I have a psychologist in place, I have a family doctor, I have a great support system around me, but even when I talk to my psychologist, she says often that the last piece that I really need is a psychiatrist, just so I can fine-tune those medications. One problem that I'm still dealing with in terms of bipolar disorder is constant anxiety and fear over having another manic episode. So hopefully with their experience, the psychiatrist that is, they can kind of relate to my situation to some of their other patients, and maybe fine-tune a medication, add a medication, take away a medication, just things that we weren't able to do on our own with my family. So like I said, I did get a call from the psychiatrist's office. We don't have a date yet for my first appointment, but they did say that they are willing to take me on as a patient. So again, it's really good news, and it's definitely going to change the course of my treatment moving forward. The first change that I personally have in mind would be to change my Zeldox, which is my daily antipsychotic, to Latuda, because one thing that I do struggle with aside from the anxiety is depression throughout the whole year, but more severe, like I said, in the winter months. But Latuda is supposedly more helpful than Zeldox in treating depression associated with bipolar disorder. So that's a change that I asked my family doctor to make, but like I said, they didn't feel comfortable adjusting the psychiatric medications when they were already prescribed by a psychiatrist when I was in the hospital. So now an ideal situation would be to have an appointment around September or October, right before the depression usually sets in, fine-tune some medications, and then maybe have another appointment after winter when I'm kind of switching from that zone of depression into the zone of mania. Maybe take away the antidepressant, add on a stronger antipsychotic such as loxapine, but really just leave it up to the psychiatrist to make those decisions with myself. I will say now too that I am very proud that we managed to make it this far without having a psychiatrist. I did everything I could. Like I said in one of my other videos, I stopped using any mind-altering substances. I was very open and honest with my family anytime I felt off in terms of mania or depression. I made appointments consistently every 2 weeks with a psychologist to talk through how I was feeling and use her as kind of something to keep tabs on me. She could kind of hear of the stuff I was talking about, see if it was consistent from week to week. or from bi-weekly to bi-weekly, to make sure that I was still staying on track and I wasn't going too high or too low. So I almost kind of feel like this is a reward for putting in that hard work, doing everything I could to remain out of the hospital and remain healthy. And now I'm finally going to get to pass some of that responsibility from myself and my family onto the psychiatrist and kind of form that relationship moving forward and hopefully stay out of the hospital for good. All right, well, that's all I really wanted to share with you guys today. So just the big news with my mental health treatment for bipolar disorder is that I finally got a psychiatrist. It's going to be a big part of my treatment plan moving forward. All right, that's it for today. Take care.